Today, healthcare is moving from treating illness to managing patient outcome. So, what you have to say on this?
Technology and infrastructure, they are important, but it cannot create trust. AI is everywhere in healthcare, but AI cannot replace human touch.
In India, we are having very high patient volume, and at the same time, having this empathy with the same experience, it's becoming very difficult for the clinic.
Patient does not bother how much you know. Patient only bothers how much you care. आपको कितनी knowledge है, मुझे उससे नहीं लेना. आप मेरे को कितना care कर रहे हो.
Thank you. Today, we have Dr. Sunil Khetarpal, who brings decades of experience in shaping healthcare institution and advancing conversation around future of healthcare in India. Welcome, sir. So today, healthcare is moving from treating illness to managing patient outcome. So, what you have to say on this?
Well, healthcare is now transitioning from curative to new age healthcare systems. First thing is if we are talking of curative care, because healthcare is preventive, promotive, curative, rehabilitative, and palliative. So this is the whole spectrum of healthcare. So we are now shifting from curative care to preventive healthcare, and we are also using digital technologies, and patients' expectations are quite different now. So they don't want only the good clinical experience. So they want that healthcare should be compassionate. There should be empathy and timely, affordable. So patient expectations have also changed. So we are now moving from treatment, curative health to total wellness of the patient. So patient has to be viewed, yeah, well informed, and he has to be empowered. Patient should be involved in caretaking decisions, which is not.
This is a change which you see there has like come in a long way. Like,
Yes, yes. Earlier, it was only curative, like that we have to treat the patient, but clinical excellence, of course, is there. But there are various other factors which affects patient health.
you see is happening? Is it because of the technological advancement or people are more informed?
Well, I agree with you because technology is now playing a major role, and digital transformation is actually the buzzword if you see. So technology is helping to improve the patient outcome also through by improving the operational efficiency. So this technology has definitely played a major role. And apart from that, patients are also now very updated, right? So they have social media, they are flooded with all sorts of information. So there is, I should say, infodemic. So patients are informed. But then, of course, we need to educate the patient, and because half-baked knowledge and all this information from social media, absolutely, this is also not good for the patient, very dangerous. So we need to educate the patient. Patient should be well informed so that ultimately it is, the quality care we can achieve only by keeping all these factors in mind. Yeah.
You just mentioned about where like my next question is around the same, because whenever we talk about healthcare, so we are always talking about the technology and the infrastructure, what we can offer to the patient. But according to you, what is the key aspect in this entire patient experience perspective, and which creates a better experience for the patient?
Well, I would say technology and infrastructure, they are important because technology, enormously, it has potential to improve healthcare, improve efficiency, but it cannot create trust. So to me, most important factor is trust between the patient and the healthcare provider, right? And secondly, transparency. Transparency is very, very important. We have to be very transparent, honest billing, and not to hide anything from the patient. And third thing is the communication. That is a compassionate communication. So patients, we should,
Have that kind of relation, that exchange of
yeah, patient should be well informed. Patient should be communicated about their disease, about the outcome of the disease, and that and another thing is it is patient expectations, as I told you, they are very, very high these days. They want that everything should be accessed in a timely manner. They want timely care, they want quality care, they want compassionate care, they want to be safe. So these are the important aspects. Technology is an enabler. Technology definitely, yeah, but we cannot be dependent on technology. We cannot get away with technology. But then if we blend technology with operational efficiency or compassionate care, then it will the result, yeah, it will work wonders for the patient.
Mental health and AI in treating patient. But if we really want to test the reality, where we stand and how realistic is the current scenario in the AI's world?
Artificial intelligence is a beautiful word, and it is actually, it is playing a major role in healthcare. You can see the uses of AI in healthcare. It has a lot of potential. The uses in the preventive care, in diagnosis, in interpretation of the imaging results, predictive analysis, personalized care. So AI is everywhere in healthcare. And but then it has its own challenges also because AI, cyber security, digital personal data protection. Now the Act has come, Digital Data Protection Act 2023. It will be implemented from the May 2027. So this is the major issue, and also the interoperability issue is there, and also the algorithms. There are some biased algorithms with AI. So these are the challenges we face with AI. But and then we cannot get away with AI. AI is definitely, very much integrated into healthcare system. But then if you see the other aspects, as I mentioned that communication, the empathy, I should be try to feel myself in the patient's shoes that if I am the patient. So that is empathy, your compassion, the care. So these are the factors which AI cannot replace. So AI cannot replace the human touch, and AI cannot replace the patient expectations, which patient wants.
So that means that I have a question here because in India we are having very high patient volume, and at the same time having this empathy with the same experience, it's becoming very difficult for the thing.
I think it's a very valid question because healthcare is, in India, it is a volume-based. We a lot of patient loads, and doctors sees a lot of patients in OPD, and there's a time constraint. So he has to see so many patients in limited hours, and but that he cannot do justice to the patient. When we are consulting a patient or examining a patient or taking history and advising the patient, it needs time. But then slowly, we are moving from volume-based to value-based care. And if we communicate, we should be so efficient that we should communicate well to the patient within the limited time, which patient also gets satisfied. Yeah, exactly. I want about to talk that technology will also play a major role in that. So a lot of things will be, solved with the technology. You can do it fast, your consultation and your, monitoring part, everything. I mean, technology will definitely be a major role, enable the healthcare system to improve. The efficiency will improve.
Right. So, sir, I want, based on your experience, like you have seen different shades of the Indian healthcare system. So, if you had an opportunity, what change you would like to see in the system?
See, the current scenario in healthcare is very fragmented. So it is not a well-structured healthcare system. So I would like to change the healthcare system from fragmented to an integrated healthcare system. An integrated healthcare system is we all should, come on a work together, come on a common platform. Healthcare providers, the government, the insurers, the digital technology companies, right? Academia, right? So all these should come together and work together so that there is not only the curative aspect, we should also take care of the continuum of care also. It is not that you only treat the patient. So we have to see that the continuous care is maintained, and patient right from the entry to the hospital till the patient leaves the hospital, and even the follow-up part, right? So I mean, you also need to strengthen the referral system.
So all these, fragmented system, we need to reorganize them and make it in a structured way. So this will ultimately improve uh, outcome of the patient and definitely improve patient satisfaction.
Just mention about that we need to move from volume to value in the healthcare space, right? But there is a in like tremendous pressure from patient side or like expectation, not I'll say patient side, but expectations are there that we need to deliver care which is accessible with quality and with right amount of efficiency. So as a leader, message you would like to give to our young entrepreneurs and to your peers
See, healthcare, there is a cost,
without compromising trust?
quality, and trust, of course, yeah. The every patient expectation that healthcare should be accessible, healthcare should be affordable. At the same time, they should get quality care. So this is not something which is not not doable, It is possible. If you are investing in quality, if you are, going for accreditation, maintaining some standards in the hospital, you are investing for a better care. So because it will definitely improve your functioning, your operational efficiency, and definitely outcome will be improved. And it is not difficult to maintain, but accessibility, again, the digital health tools, you use digital tools to improve efficiency, right? To improve accessibility. Nowadays, telemedicine, I'm giving you one example. So you can, e-Sanjeevani is a wonderful platform of the government of India. The nearly 48 crore consultation have been done on e-Sanjeevani till date. It's a huge number. So accessibility, only technology can bring accessibility. And efficiency, of course, once you use the digital tools, efficiency will improve and quality will improve. So they are all interlinked, interrelated, all these three, and this is doable. And we are definitely moving towards, accessible care, affordable care, and quality care. And government is also doing
Establishing trust in the patient.
yeah, very important. I am about to mention that within all this, ecosystem, the most important factor is trust. If the patient loses trust, because the doctor-patient relationship is purely based on trust. So that if you lose trust, then it is
Matter how big is your brand and
how big is your brand, how much knowledge you have. Patient. I always say that patient does not bother how much you know. Patient only bothers how much you care for me.
that's true.
आपको कितनी नॉलेज है मुझे उससे नहीं रहेगा आप मेरे को कितना केयर कर रहे हो मैं एज अ
For
पेशेंट
that matter, he or she will like to travel like no matter where the doctor is there.
yes patient don't mind because that trust and that faith is something which will if you become a loyal patient to the doctor so we should try to retain the patient yeah
ये बोला जाता है डॉक्टर को ईश्वर मतलब ईश्वर के बाद उन्हीं को वो दर्जा मिलता है।
मानता है दूसरा रूप मानते हैं लेकिन ठीक है तो वो पेशेंट जो ठीक हो जाता है वो शाबाशी देता है पेशेंट डेफिनेटली बट ओवरऑल वही प्रॉब्लम है कि हमारे प्रोफेशन में when the patient ठीक नहीं होता है तो डॉक्टर को फिर
Yeah, for that matter, like all the stakeholders needs to work together, like be it from the clinician side or diagnostic side or like
yeah absolutely it's a multidisciplinary no or even if the patient is coming to a hospital, patient is visiting various touch points. So right from taking appointment, online appointment, visiting the hospital, parking area, then he goes to the reception, then registration, then OPD, then diagnostic, then inpatient. So patient is visiting various touch points in the hospital. And patient wants to have a good experience in every touch point. So one bad experience in a particular touch point will lose confidence in the patient. So we need to, work as a team, all across all levels of employees in the hospital, right from the front office to a nurse, to a doctor, to a technician, to a housekeeping. So at every level, I want satisfaction.
many platforms speaking at many platforms you've been a speaker and the mentor. According to you, platforms like India Health, how it help the system to work more collaborative manner, and what kind of outcome or discussion you look forward from such platforms?
Well, India Health is a wonderful platform, I should say, and I have been associated with India Health right from its first edition, and now, we are entering into the third edition of India Health. So, what I found that India Health is a great platform, and all stakeholders, industry stakeholders, they come on a common platform, and it's a great opportunity to learn from each other, to share knowledge, to collaborate, and to network, and grow. So every stakeholder need to grow in the industry. So until unless they come together, learn, they share their best practices, they cannot grow. So it's a wonderful opportunity. And what my expectations with India Health third edition for this upcoming India Health event is that we need to have a lot of discussions on not only some individual technology or some individual topic, but we need to think something broad, something big. One is that we should talk of public-private partnership. Number one. Number two, we should also discuss about the digital health technology. This is important. We should talk about finance part, healthcare financing. We should also talk about how do we improve the operational efficiency? How do we improve patient satisfaction? What is patient experience? All these topics should be covered. And then we should also talk about the insurance sector. What are the various issues which, there are various stakeholders involved in that. Providers are there, insurers are there. And, we should talk about the regulations, legal compliances in healthcare. There are regulations, and that's why I said we need to collaborate with the regulators, with the insurers, with the providers, with the government, and all sectors should come together, industry, academia. So all these topics which concerns all sectors of healthcare, right? We should discuss. Then only we'll be able to achieve a meaningful outcome of this event.
Thank you so much for sharing your time and your insights with us. We are really happy and thankful to you, and we look forward for such more collaboration.
Thank you. Thank you for having me this evening for the podcast. Thank you so much. Thank you. And best wishes to India Health.
Thank you, sir.